are you more or less likely to treat a specific kind of cardiac patient for their atrial fibrillation?
That's a great question. We see a lot of different patients, and the people that I really focus on are the people with diastolic dysfunction. And I think the classic example are the patients who have aortic stenosis, thick ventricles, poor filling, and they actually tolerate AF very poorly. And so those are the people that I work the hardest to get the best result for. They potentially have the best symptom relief, and they come back and they often tell me about how they feel great. And that's not always the case if you just fix the valve. And so it's a really important concept, especially in these thick ventricles with diastolic dysfunction, poor filling times. Those are the people that I really work hard to get the best result for.
Yeah, I totally agree. Do you always do a right-sided ablation, or when do you or when don't you just do a right-sided ablation?
Yeah, another excellent question. And there's a lot of debate. There's a lot of people out there. They're purists, and I'm not necessarily a purist. To some extent, I do what's practical to me. I don't always do a right-sided ablation. If I have an older patient that's undergoing a complex case, I really focus on the left-sided lesion set, and I do it well, and I do it thoroughly. But I don't always open the right side. If I'm opening the right side for other surgical reasons, I always do it. But the right side is something that can be done effectively with catheter ablation. And if there are clinical reasons not to do it, then I think you have to make those balanced decisions.
Right, for sure. I'm sure you face the same issues being at a teaching institution. Whenever I'm teaching my fellows, we start with the pulmonary veins, and then we do the left-sided lesions, and then we add the right-sided lesions. And I agree. I think there is some growth in the procedure, just like all the other surgeries that we do. You kind of add things on as you get better and more comfortable with them. And you're totally right. I mean, an endocardial ablation for the right side can be done so well by the EPs that sometimes it turns out to be the most appropriate thing to do is do your left-sided lesions really well, and then let the EP help you out in kind of that heart team model with that right side.